Hi, this is Dr. Paul. Happy Saturday from Brilliant Life Chiropractic. I was having a conversation with a patient, a practice member the other day, and it reminded me of something I talk about a lot, which is that the tension, the muscle tension that we feel in the body is there for a reason. The body usually doesn't do it as a mistake. It's not like, yeah, just randomly throw some muscle tension into your neck. No, it's there for a reason. And the example that I love to use for this is if someone gets into a car accident or another situation where you might get whiplash, So the neck goes through this really extreme range of motion, usually pretty violently. And it injures the neck, right? It injures some of the soft tissues, the bony structures, maybe the discs, and the muscles, potentially too, will splint as a way of protecting the neck. They get very, very tight and painful. And so if you go to a medical doctor, if you go into the ER, what are they going to do? They give you pain relievers and muscle relaxants, and then they give you a neck collar. And on the surface, this makes sense. It's like, oh, we'll help you feel better, but then we'll protect your neck. Well, here's the thing. That pain is there for a reason. Now, if you're in ridiculous amounts of pain, I understand having to get pain relievers for that. But if you can manage it, I suggest that you do so, and here's why. The pain is there for a reason. When the muscles splint, they're protecting your neck. They do a better job of it than a neck collar. The pain tells you how far you can move. The pain says, oh, I can move that far out. That hurts. So I better not do that anymore. And then the next day it might be, oh, I can move that far out. I better not move any further. But you see, that's progressive improvement. The movement is actually helpful with the restoration of soft tissue. And the pain tells you when to stop. And it's very interactive. It tells you immediately when you need to stop. A collar will not tell you. A collar will just restrict your range of motion. And then taking muscle relaxant takes the muscles out of the picture so that they can't protect you and they can't do their job. And so I see this as kind of a backwards way of approaching healing. I think what we need to do is support the body. Listen to your body. If your muscles are telling you don't move that way, don't move that way. And do what you can to be comfortable and allow the body to do the healing that it needs to do. And I feel the same way when it comes to things like ice and ibuprofen. Ibuprofen will reduce inflammation, sure, but that inflammation serves a purpose. There is a reason why you have inflammation. It is the first step in healing. It brings blood flow to the area. It allows the area to be painful so that you know what you can do and what you can't. Whiplash is one example of this, but you can use it for any other level of tension or any other pain or symptoms that you have, pretty much. But whiplash is a great example. And taking a muscle relaxant, again, it works against what the body's trying to do. So if you can manage it, if you are suffering from this, do your best to manage it. See if you can do it without those kinds of things. I tend to throw heat on even acute injuries like that because it supports the inflammatory process and allows the body to do what it needs to do. Now, if it hurts, don't do it. If you find that heat makes it feel worse, don't do it. And if you're worried about like a really severe injury, like a fracture or something like that, and you're really in unbearable levels of pain, go see a medical doctor, get yourself those pain relievers. But if you can manage it, I suggest that you do so. At least that's the way I would manage it if it happened to me. And that allows your body to heal the best way possible. And then also, of course, come and see me. Go see your favorite chiropractor, if it's not me, and let your brilliant life shine. Allow your body all the tools that it needs to take care of itself in the best way possible. So this is Dr. Paul Martin with Brilliant Life Chiropractic. You deserve a brilliant life. Let it shine.